Hello everyone, welcome back to my channel. So in today's topic, I'll be telling you everything you need to know about vaginal yeast infection. I'll be telling you the cause of vaginal yeast infection, the symptoms, and how we can treat it, or how this vaginal yeast infection can be managed. So my name is Nay Yvonne. If this is your first time watching me, don't forget to like, subscribe, and turn on your notification bell. So, and also please kindly share this video with others so they can also benefit from this knowledge. Stay tuned. So like I said already, we'll be talking about vaginal yeast infection, but before I proceed into this topic, I would just want us to understand what is this vaginal infection. Vaginal yeast infection, another name for it is known as thrush. Some people will also call this candidiasis. So any of it, whether it's vaginal yeast infection, thrush, or candidiasis, they are of the same word. So vaginal yeast infection is being caused by a yeast, which is a fungi. It lives in the vagina, so they are natural resident of the vagina. So this yeast, they live with other healthy bacteria which are also living in the vagina as natural resident. So they are being kept under balance by these natural and healthy bacteria. So in case something happens that will kill these healthy bacteria, or that will affect the growth of these healthy bacteria, what is going to happen is that these yeast cells, they are going to seize this opportunity and they will then grow. And when they grow too much, they tend to also multiply too much, and then they grow out of proportion. And when this happens, that's when we'll start having this kind of burning irritation in our vagina, which is known as vaginal yeast infection. So some of the factors that might cause this vaginal yeast infection, for example, if you are taking medication known as antibiotics. Antibiotics, they are there to treat infection and also kill bacteria in our body. So what happens is that if you are sick and you go to the hospital and the doctor prescribes you an antibiotics, while you are taking these antibiotics to help treat your infection, it's also fighting against these healthy bacteria that are living in your vagina. And what happens is that it tends to kill these healthy bacteria. And once these healthy bacteria are dead, or the population is being reduced, they will not be able to manage these yeasts which are also living in the vagina. So the yeasts now are going to seize this opportunity and they will tend to start multiplying very fast. And when that happens, they grow out of their normal balance. And when that happens now, we will start having this irritation and burning sensation in our vagina area. And at times also, the consistency of our vaginal discharge is going to change as a result of this yeast infection. So that is what happened. Another factor that can affect you and cause you to have a vaginal yeast infection is if you are pregnant, if you're on contraceptive pills, because when you are pregnant or using contraceptive pills, there is a change in your hormone in your body. So when there is a change in hormone in your body, it might also affect the healthy bacteria that are normal resident of your vagina. And when they are affected, maybe being killed, or maybe something has happened that will change their normal pH level, what is going to happen is that the yeasts are going to seize the opportunity and they'll start growing very fast and multiplying very fast, leading to vaginal yeast infection. Another factor that can cause you to have vaginal yeast infection is if you have a weakened immunity. A weakened immunity, like maybe you are having an underlying medical condition, for example, you are HIV positive, or maybe you are a cancer patient who is receiving chemotherapy or maybe radiation treatment. When that happens also, maybe you are HIV positive taking antiretroviral drugs, it's going to affect or kill these healthy bacteria living in your vagina. And when this happens also, the yeast will take this opportunity and multiply very fast. And when they multiply very fast and grow out of their normal balance, it will lead to vaginal yeast infection, which is known as thrush. So that is the cause of this vaginal yeast infection. Another factor that might cause this vaginal yeast infection, it's your normal lifestyle. For those who love to do douching is not usually advisable, but still some ladies are still doing that. So douching is the act in which you take water, maybe in a pump, you tend to pump it inside your vagina in order to clean it. When you do that, you wash out those healthy bacteria that are there in your vagina, protecting you from infection. So when you wash them out, now what happens is that the yeast will be there. They are independent now. They don't have anybody to control them, to keep them at a steady rate. So they will tend to start multiplying very fast and growing very rapidly. And when that happens, it will lead you to have vaginal yeast infection. Another factor also is for those that are putting on very tight underwears, or maybe putting on nylon underwears which are not good in absorbing moisture. That is why it's always advisable for you to always put on a cotton underwear. So when you're putting on a tight underwear, or maybe you are sweaty and you have not changed your underwear, it's going to provide a good and favorable condition for those yeast to grow. And when they grow very fast also, it's going to lead you to what is known as vaginal infection. Another factor is if you like to sit in very hot water bath, or maybe hot water bath that has very strong detergent. They are going to kill these healthy bacteria that are living in your vagina, and when that happens, you are going to have vaginal yeast infection. And for you to know you have vaginal yeast infection, you are going to be having some symptoms, like your vagina is going to be so sensitive, you are having burning sensation, irritation in your vagina. When you start having those kind of burning and irritation in your vagina and vulva area, definitely know you have vaginal yeast infection. Another symptoms for you to easily determine you have vaginal yeast infection is the change in the consistency of your vaginal discharge. You know, a normal vaginal discharge is usually clear, off-white, or at times white in color, and usually vaginal discharge does not usually have an odor. But if you want to have an odor, the odor will not be that strong, and it will not be that offensive, and also it will not be that unpleasant. So that's how it is. So in the case of a vaginal yeast infection, the consistency of your vaginal discharge is going to change. So most of the times it's going to change to white, thick, clumpy, looking like cottage cheese. If you start producing that kind of thick, white, clumpy kind of vaginal discharge, definitely you should know you are equally infected with vaginal yeast infection, which is known as thrush. But for some people, the change in the consistency of their vaginal discharge might be so minute that they will not notice, because maybe it's just going to stay in their vagina. It might not come out. The quantity might not be that much, so they might not even notice they are infected with this vaginal yeast infection. So for some other people, they are going to experience tear or little cut around the entrance of their vagina, and also around the lips of their vulva area. So when that happens now, when they want to pee, they will have this burning sensation. The burning sensation is as a result of the fact that the pH of pee is very acidic. So when it's coming out now, it will enter those tiny cracks, giving you that pain-like burning sensation kind of feeling. So those are some of the signs that when you have those kind of burning sensation when you go to pee, definitely you should know it's vaginal yeast infection. You might also experience pain during sexual intercourse. When the penis is about to get into the vagina, you will feel pain around the entrance of the vagina, which is as a result of those tiny tears or cracks that are around the vagina or the vulva area. So it's going to be painful. So if you start having all of these signs and symptoms in your vagina, definitely you should know you are infected with a vaginal yeast infection. So these are the symptoms you are going to experience if you are infected with a vaginal yeast infection. And like I said already, one thing you have to take note is that this vaginal yeast infection is not a sexually transmitted infection. It's being caused by those natural resident yeasts, which are fungi living in your vagina. And the name of this fungi is Candida albicans. They are normal resident of the vagina. So they stay there at a normal rate. In case everything is okay, they are being maintained at that stable rate by the healthy bacteria. So together they live there, and the healthy bacteria will make sure the yeast will not grow and multiply very rapidly. So they keep it at a stable rate. So anything that will affect the health of these healthy bacteria is going to promote the growth now of this yeast. And when they grow very fast, multiplying very fast, they tend to grow out of balance, leading now to what is known as vaginal yeast infection. So if you are infected with vaginal yeast infection, don't be scared. You might have it even when you are not sexually active. You might have it even when you are sexually active. So it's just something that can happen to you. So how can it be treated? You can easily, the good part is that you can easily buy your medication over the counter if you are very certain that the symptoms that you are experiencing, it's vaginal yeast infection. If you are not quite certain with it, you have to consult with the doctor, and when you consult, the doctor is going to know best what you are infected with, because there are other sexually transmitted infection that might also have this similar kind of symptoms like that of a vaginal yeast infection. That's why most of the times it's good to always go to the hospital and consult with the doctor. So the doctor will be the one to really diagnose and know the perfect kind of infection you have, and when that is done, the doctor will also know the best kind of medication to prescribe it to you. So you can equally take the oral kind of medication, which is fluconazole. So you take that, and you can also take maybe the tropical one, which is a rub. You apply it on your vulva area in order to relieve the redness and the swollenness of your vulva area. And during the application process, you have to apply it for a duration of 1 week. And at times also there is a suppository form where a drug where you insert it inside your vagina. That one comes with an applicator stick, which you will attach the drug on it. Then now you can use the applicator stick to push the medication inside your vagina. So it's always good to apply it during the night when you are about sleeping, so it's going to work perfectly well without leaking out. And then also during your medication, one thing you have to do is that you have to stay away from sex. You need to practice abstinence within that period. So, and also make sure you take your medication as being prescribed by the doctor. If the doctor asks you to take this medication for a duration of 1 week, make sure you follow the right prescription and you take for that particular duration. If you don't take for that duration, you might have reoccurrence of the yeast infection, and when that happens, it might be more severe than it was before. For some people, this infection might be asymptomatic. For some other people, it might be symptomatic. In the case where it's asymptomatic, no need to go to the hospital, because definitely you will not even know that you are infected with vaginal yeast infection. So in the case where it's asymptomatic, you might not have any symptoms, no irritation, no burning sensation or tears or crack in your vagina area. But if in case you are pregnant and you realize you are infected with this vaginal yeast infection and you don't have any symptom, it's always good to treat it, because at that state it's very risky, might affect the health of your unborn baby. But this way it's symptomatic and you start having burning sensation, irritation in the vagina and vulva area, and usually also you will have those tiny cracks and tears in the vulva and vagina area, and during sex it's going to be painful, and when you go to the washroom to pee, you are going to have this burning sensation as a result of the fact that the pee is leaking into the cracks. So always make sure you practice a good hygiene in order to avoid this vaginal yeast infection. And one thing you can do to avoid the reoccurrence of this vaginal yeast infection is that make sure you practice good hygiene. Good hygiene is the most important one. If you go to the washroom, make sure you wipe from front to back. Avoid wiping from back to front, and also avoid sitting in hot water bath. Make sure you put on cotton underwears and not very tight, so that air can circulate in your vagina area. And make sure you always change wet clothes. If you go out and you do a strenuous exercise and you are sweating and you are back, make sure you take off the cloth. So all of these things is going to help you and prevent you from having vaginal infection. So if you have been watching without subscribing, please kindly like, subscribe. If you have any comments or any doubt, make sure you drop them below. I'm going to answer them. Stay safe, and remember, I love you all. Ciao.